Hi, Matt Sitter from AFN here. At AFN, we believe that change is where opportunity happens. The best way to find opportunity in change is a network that is diverse in experience, expertise, and perspective. For our fireside chats, we like to talk to our CEO members to be able to learn from their experiences and the great things that they've done and maybe apply those into our own lives. Today, we've got Dr. Ron Dixon with us. He's CEO of CareHive. They're a data-driven care organization, founder of Healthcare 360, and he's an internal medicine doctor. Ron, awesome to see you.
Awesome, and thanks for having me, Matt. Pleasure to be here.
So maybe if so it's an interesting journey. Not every physician is cut out to be an entrepreneur. I think that, like everyone, there's a subset of us out there. But can you tell us just a little bit about your journey from being a doctor to, being a organization head, being a CEO?
Yeah, and certainly. I don't know if I wanted to be a doctor from when I was a child, but I know my parents kind of were like, you should be a doctor or a lawyer, so I had to choose one. Um, and I think I was always an entrepreneur. And when I got my paper route, the first thing I did was try to grow it to cover the entire neighborhood, and then I actually um, kind of subcontracted it and
Nice.
made margin. So I think I always wanted to be an entrepreneur. I don't think my parents were really fond of any of that risk or really understood why anybody would want to do that. So they shepherded me in a certain direction. And when first I went to grad school, then I went to medical school, and then in residency I wanted to do internal medicine. And then I wanted to subspecialize, and I'm Canadian, so I started to work. I had to work on a visa, H-1B visa, before getting a green card. And it was through working that I really became interested in innovation and change, and really kind of healthcare delivery change, leveraging technology to deliver healthcare. And actually, I've been very interested in um, prediction, and early prediction is as a doctor, you walk into a room and you kind of can be like, this person looks good from the door or doesn't
Hmm.
look good.
Yep.
When you're doing rounds, that actually means a lot, because if somebody doesn't look good, you actually spend a lot more time. And I thought it'd be really interesting to apply that to outpatient medicine. Um, and of course, it's a different data set that you're using.
Yeah.
So when you're walking into a room, you actually have objective data around labs and tests, but then you also can see the patient, what their color looks like, um, what their overall kind of sense is. But as an outpatient, you don't necessarily have a lot of testing information, and then people generally look okay, except under certain circumstances when they're walking
Right.
in the
Right.
door. And I thought it would be neat to figure out ways to predict who actually might need more time with a doctor.
Okay.
And then if you take that to the next level, who actually needs to see a doctor at all, um, versus who could get their care managed through other means, whether that's a teleconsult or asynchronous um, care, meaning you're exchanging data, you're asking patients questions about their condition, but they're not in front of you. And then that adds the convenience of time,
Sure.
the time pressure, right? So it adds the convenience of time to the patient. They can respond, I always said in their pajamas after they put the kids to bed. Or the physician can review those things and batch and review them really quickly. And what you can do then is add, at the time when I started to work on this, it was very early. Um,
What's that? What year was this that you were starting to think really hard about this?
2006.
Okay.
So, and it doesn't pay, and I've told you this before, and I'm sure all entrepreneurs can feel this. It just does not pay to be early. It's just super
Yeah.
painful. Um, so there wasn't a lot, there weren't really great ways, the concept of big data and neural networks and AI was like, I think it was in its infancy. But when we thought of, predictive modeling and then figuring out who might need what with data, we were thinking very algorithmically, right? Like coming up with specific decision trees and decision pathways. So we
But you would
come
have to build them all out, right? Instead
decisions.
of,
Yeah, so that if a patient answered these questions
yeah,
based off of it's a depression inventory and they answered these questions and they scored this, then the pathway is they need an in-person visit and they need to increase the medicine. But if they scored this, then maybe they need a virtual visit and they're steady, So
right.
um that's really what led me to down the entrepreneurial path. And that is the genesis of the first business that I focused on, Healthcare 360. And that was built in conjunction with the hospital system and hospital leadership that I worked in at Mass General Hospital.
One question I have, we'll dive into all that a little bit further, but thinking about like, as a physician, I think that you took a lot of important experiences out of that. You're saying like, hey, my instinct actually can inform me when someone walks into the room and they don't look good. That's going to tell me about something. But I would say your impact is narrow but very important in that. And part of what you pursued in these bigger ideas is to have a broader impact. Can you just say a little bit about how much those scratch different itches for you and why
Yeah.
each one of those is important?
Um, I think as an entrepreneur, as an entrepreneur, you have big ideas, and big ideas, you want to have big impact. And I loved actually the individual impact that I could have on people as a physician. And especially when you do something that actually impacts their life. So it's not like I wasn't a trauma surgeon, so every day you're like, saving someone's life or not.
Right.
Um, but there were some times where you made a diagnosis or you caught something and then they would credit you with basically saving their life. And that's it's a wonderful privilege to be in the room with people, to have that opportunity. But at the same time, it's a one-on-one. And
Mm-hmm.
I was thinking about how do you build solutions that actually can impact thousands, if not, hundreds of thousands. And the only way to do that, in my estimation, was not leveraging people, but leveraging tools.
Right.
Technology is a
Right.
tool to leverage, and then data is a very important tool to leverage.
Right. Yeah, I mean I like that you bring up on leverage around this because it's just like, hey, how do we know some of the right things to do or we think we do, but the individual attention is always going to be a limiting factor for us. As you're thinking about the evolution into CareHive, can you tell us a little bit about what CareHive does and how that
Yeah.
feeds into this idea of like data and leverage that you're thinking about?
Yeah, I think the theme, so my thematic interest has always been predictive analytics and navigating patients into different pathways based off those analytics. And I was really initially focused on in-person versus synchronous telemedicine versus asynchronous telemedicine as the navigation pathways. And when I went to CareHive, I was introduced to some health plan CEOs, and they said, that's very interesting, but we'd love to leverage the data science aspect to understand our network better and do some soft network arbitrage. So if you can understand that, especially in plans where there's a significant amount of spend on the
Yep.
patient side. So let's say a some of the Accountable Care Act plans, right? So
Mhm.
there where patients are typically they're not Medicaid, but they're above Medicaid, but they're
Yep.
very price sensitive. And people don't understand now that in a network, in a plan network, there's a huge spread in price for the same
Yep.
thing, that the plan doesn't really have a mechanism to softly and gently, so-called, navigate the patient towards a price point that might be better for them, that might actually
Yep.
encourage them to get the thing that was ordered instead of skipping it. Um, and of course, that side of care for the patient that is cheaper is also much cheaper for who's paying generally. So there's a match
Mhm.
there. So there's
Right.
a mixed incentive. So we now focus the data aspect on a predictive analysis of who in the plan might benefit from this type of arbitrage. And typically those are people with chronic disease. So that's always been a focus of mine. And then we leverage software to help, engage and navigate these people to different outcomes. And it's not just software, we also have people, we have navigators, we have actual people who can talk to someone and guide them and help them understand why this is important.
Uh, yeah. So the human element is important, but when we're thinking about this, why do you think people need that extra, someone to help them navigate through it instead of just spitting out the answer? It's just like, hey, you ought to be getting your glucose done over at Quest
Complex.
Diagnostics instead.
It's just so complicated, right? I think, you're a healthcare expert. I'm a healthcare expert. Um, but I recently, unfortunately, herniated a disc in my back.
Oof.
Yeah, that really hurt, man. It didn't feel good. But I've heard of playing hockey before, and then finally it, herniated through, trying to exercise like a younger person. And my doctor sent me to do a, eventually sent me to do an MRI, and he wanted me to get it done at a certain place. And I knew that if I got it done somewhere else, I would pay out of my pocket like half.
Okay. Yeah. Yeah.
Because I mean, I'm in the business, so I asked him, and he kind of was like, "Well, you can get it there, but it might not be, as good. But I guess I can get it." And then he's like, "That's fine." And so
Okay.
just by doing that, it saved me $250 out of my own pocket. Um, and that's because I'm a knowledgeable, kind of healthcare consumer, right?
Right.
But
Right.
so many people don't know that, you know, you can actually do that. Um, and there are a lot of people who are very price sensitive who might not follow through with things because of the barriers around pricing.
Yeah. They won't get that care at all.
Right. So what we're trying to do is kind of make it a little bit more transparent in terms of, the pricing. And we envision that this scales beyond simple things like labs or x-rays.
Yep.
It scales up on the service line, but of course that requires more trust. So you have to build
Yep.
trust with the patient populace before you move up that service line.
Um, the physician that you were talking to, he said, "Oh, it might not be as good." Why do you think physicians are guiding people in a certain direction on these type of things, which, you know, may or may not be the best thing for the patient?
It's multifaceted. It might be convenience, right? So it might be that if you do it there, it immediately integrates with their medical records. So there's not
Yep.
all continuous integration across all the different systems. There might be a perceived difference in quality. Um, and when that that gets more interesting when you think about more advanced services. But when it's things like radiology, I think that's a harder argument. And then they're just relationships. So they might,
Yeah.
their personal relationships. They might know someone, and then their financial relationships where there might be um, a benefit from doing something within an internal um, radiology suite or lab. But at the end of the day, I remember as a physician when patients would ask me, can you get this done? Can you have me do my lab somewhere else, or can you have me go
Yeah.
here for my care because it's just more convenient or cheaper? I'd always be like, well, of course, right? So
Right. But you had to ask.
the patient would have to ask,
Yeah. Yeah.
correct? But I would always say yes.
Um, well, I think this is really an interesting element of healthcare overall because although the doctor said it might not be as good, right, there could be a whole host of reasons that's an easy reason to latch onto. And, I think in healthcare, we have a situation where you could consider it market failure overall because there's not transparency on price and not always transparency on quality. So in an environment where, essentially you've got market failure, um, how do you think what opportunities do you think actually sit out there for the entrepreneurs like you to be able to do something to help the system work better?
Well, I think you have to hone in on the healthcare. I hate the word consumer because that's, as a physician, I always think of patients, but not everybody is a patient because a lot of folks are healthy. Um, but if you focus on the consumer slash patient and you try to make their life, easier and the
Yep.
experience of healthcare better, while also focusing on a financial problems for the entrepreneur, what I always say is, the first thing you need is a business model. The second thing you need is customers. And then the third thing you need is that product or service. Like that's the last thing that gets developed, right?
Yeah, right, right.
So, you sell well ahead of your skis, uh, but you need a recurring revenue model and you need, people who are going to actually pay you for it. Because then you have a business and then you can develop your product um, over time. But if you do focus on having that scalable and repeatable model while satisfying patients and giving them healthcare in a way that they access to healthcare in a way that they kind of understand, which I
Hmm.
think is extremely difficult, right? It's so obtuse when you get these um, EOBs, right, from your health
Right,
plan,
right.
and you're trying to get a procedure, and then they say you're denied, and you're like, what does that mean? Are you trying to get a medicine and it's not allowed? And it's so
And the
complicated.
dollar values are absurdly high, but no one ends up paying those. And
Yeah, it doesn't make any sense.
yeah,
So on the consumer side, if you can start to make things make sense and create tools and innovations that make things make sense while impacting the overall cost, I think you're going to win. If you're just adding things, if it's just like a fancy little shiny object, and AI is a great kind of um, example where everybody's talking about AI, but who's actually leveraging it effectively so that it's improving all of the constituents in the healthcare, food chain, patients, clinicians, and payers. If you got all of those folks somewhat aligned, I think you can do something that's really interesting.
well, I think that you said this earlier. It's just like an incredibly complex problem, and we have made it all the more complex with the number of middlemen that we've got in place, and like the payers and all these different elements that are out there. when we think about the physician, they're one of the key components of how a patient actually interacts with the healthcare system. Although, there's a ton of other people that they're touching. Um, Many physicians went to medical school because they wanted to treat patients. They didn't want to be thinking about economics relative to the patient. Do you think that, and I think that we're also in this trend where physicians are more often becoming employees now than sole practitioners as well. Do you think that they're going to have a greater understanding of economics of the patient, or do you think that that's just going to have to be filled somewhere else, and we're going to have to be clear on what the physician's job is around it?
Um, that's a very difficult question to answer. I
Yeah.
will say that it's a crisis for physicians right now.
Okay. Yeah. Yeah.
And the crisis is really about the work. Um, because when I started, and granted now I feel like a grandfather because it was, my first billable visit was in 2001. It was really actually quite easy to see patients, because EMRs were just coming in,
Yeah.
but billing was real basic, I would write a note, I would see the patient, write a note, and then do a bill really quickly. It was super fast. And there was like this, and all the stuff that's valuable, like medication reconciliation and referral management and population health, that's extremely valuable. Um, but we didn't do it. So
Yeah.
that was like super fast. So I could
Yeah.
like
Yeah. Right. Right.
call the patients and then write my notes and then go home and go for a run. And then go back in the morning. Um, and then that all changed because of all of the different things that got put on clinicians because we had more ways of collecting information and we had the electronic medical record and we had ways now to communicate with patients through the portal. And
Yeah.
then all of that got piled on to just the other stuff to make the job is fairly
A
untenable.
lot more admin now that you got to do.
Yes, a lot more admin and docs are just, especially primary docs, they just are so overwhelmed and
Hmm.
burnt out. Um, so asking them to think about payment on top of, or asking them to think about anything else is just,
It's a crowded space in their heads already.
it's a non-starter.
Yeah.
You have to take stuff away.
Right. Right. Um, well, maybe just to shift gears slightly. So, you moved into you had this desire to have a greater leveraged impact that's out there. When we're thinking about you actually leading groups of people within an organization with business as an end, um, what helped you in your experience of being a physician on that? And I would say, what's the counter on that? What really surprised you is just like, hey, I thought that this would have worked differently.
I think what helped was, I did manage people as a physician. I became a medical director. Um, and as a physician, especially when you're doing generalist care, I did both office-based and hospital-based care. You just walk in a room and you don't know people. So you got to assess people real quick. You meet
Yeah.
people in various stages of distress, or maybe they're there for a healthy visit, but often people I would see were sick. So you just get very comfortable kind of meeting people and assessing where they are,
Okay. Yeah.
meet them where they are to get the right information so that you can do your job. And that's kind of what you do when you're leading people in business. It's a different end point. But as long as you and that person or that team have aligned goals, my aligned goal with the patient is to try to get you healthy.
Right.
Aligned
Right.
goal with, a team member or a team is to bring the business forward to a certain goal. Of course, I would say that one of the biggest things I learned is that in a business, you can have misalignment, and that can kill your business.
Yeah.
Typically, patients and clinicians, we both want people to be healthy and get better or whatever. So there's not often misalignment, although there can be communication challenges, right? And then some people want, well, I want this therapy, I need it, that can be a challenge. But the desired outcome is the same. And often in a business environment, ego can get in the way, and then turf can get in the way, and that has been a big learning point.
All right. Well, what's got you excited for what's coming next for CareHive?
I'm really excited. We've been working on a large payer deal for a long time, and we're finally getting that over the finish line. And then
It's great news.
opportunities. We acquired the IP that I developed while I was at Mass General, and we're looking for opportunities to leverage that. We built a pilot AI tool that does what we were doing at 360, but now it's 2025, so you have the capacity to actually have the AI interview people asynchronously, as long as
Right.
the gates around the questions that are asked and
Okay. Yeah.
the responses, and then you can have the AI create documents that the physician has to okay. So for certain things that, following up diabetes or following up hypertension, as long as you get the right information, the AI can do everything and then make the suggestion from a clinical perspective.
Is the vision of this just that like it looks like you and me talking right now, but I'm the AI bot and you're telling me what's going on with you?
Um, yes, although it's asynchronous, right?
Okay.
So
Yeah.
this is asynchronous.
Okay.
It's not a
It's not video enabled.
no, because again, the idea is you're trying to make it convenient for the patient.
Right.
And so then the nice thing about AI is the patient can outreach anytime, and then AI can respond and
Yeah. Yeah.
pull information and then also escalate appropriately. And that's the big thing in healthcare is you
Right.
want to know, when do you need to see a doctor right away, or when do you not? And AI can help with those, as long as AI is as smart or as dumb as the instructions you give it. So as long as you
Right.
give instructions,
Right.
you can be very efficient.
Good deal. Well, Ron, excellent discussion. I know I learned a ton. Thank you for giving us a little bit about what's going on with the healthcare system and what CareHive's doing.
Oh, my pleasure, Matt. I'll sit down with you anytime. You know that.
All right. Good stuff.
Thanks.